Our special time for kids for the record on bullying continues now with a different perspective offered by Dean Clinic Family Medicine Doc Joanna Bisgrove. And Dr. Bisgrove, thank you very much for joining me today.
Absolutely, thank you for having me.
I know you care a lot about this topic. Why?
Well, it starts kind of as a lot of things. A lot of our passions do starts when we're kids. I have a hearing loss. I've had one since birth, hearing aids in both ears, and I have a speech impediment. And then I used to be teased quite a bit, made fun of. Kids would whisper so I couldn't see, made fun of my speech, and they bullied me. And it stank. It really did not feel good. And one of the things about bullying is sort of the power balance. And so becoming someone who educates kids about bullying and families about the harms of bullying is a way to sort of take that power back, and it's part of why it's become so important to me. It's like, this does not have to happen. It should not happen. And so it's one of those ways a lot of people do. I mean, we had Leroy Butler here in town recently, and he said the same thing. It's kind of taking your childhood and bringing those experiences forward to make a difference. So it's where it comes from.
Was there even a point during medical school when you thought, this is something that I'm going to be able to use in my practice?
It really came about, I think, more in the last about a year or so, as really realizing what's happening in the community. I've got two kids, a 6-year-old and a 3-year-old, and kind of learning how do we teach them to be good citizens, making sure my girls are good citizens and not pushing others around, and also being resilient to others. And then as a physician, as a small town physician, really became important to me that this is something that not just for my family, but for every family.
Do you have a sense it's gotten worse?
It's gotten different, I think. Cyberbullying, obviously now with the internet, is a much, much bigger deal. That kind of stuff can occur underneath the radar. What happens is that it's a little harder to catch, a little harder to see in terms of what's happening. And sometimes what you're looking for with the kids, your child may have their cell phone, especially teenagers. That's usually when you see more the cyber bullying. Young children aren't on the internet as much, and so they don't. Theirs is still more the playground, the physical, the things that are a little easier to see. But something like cyberbullying, if you see your teen or your young teen, they suddenly freak out when their cell phone vibrates, or they're nervous about the computer. Sometimes you have to worry, is they're being cyber bullied, is something happening?
Yep.
So that part does make it a little trickier to find now. That's more under the radar. I think as a whole it's about the same. I don't think it's getting worse or better per se. I think the cyberbullying makes it harder.
Sure.
The bigger awareness is making it easier, but it's balancing each other out.
What do you look for? What are the signs that you look for?
That a kid might be bullying, or that a kid
is being bullied, I guess.
Is being bullied.
But either way, I mean, somebody comes into your office, I suppose you look for both.
Usually in the office setting, there's conversations coming up. Things we're looking for are unexplained physical complaint. The kids are, a lot of times parents come in, they're like, my kid does not want to go to school. They get a stomach ache or a headache or something on a school day, they're fine on the weekend. What's going on? Are they not doing well in school? Which sometimes goes along with it. So something's going on that makes them not want to go to school, which is where a lot of bullying occurs. It occurs outside of school as well, but often at school, on the playground, outside of the view of adults is where it happens.
Sure.
And so if something's going on, I ask, okay. And you can't ask straight out, are you being bullied? Because there's a lot of fear in victims that, well, if I tell on the bully, it's going to get worse because the bully is going to get mad at me. Right. So you kind of ask so gently, how's everything going? What do you and your friends like to do? Do you have a lot of friends? Do you hear kids say mean things about other kids? How does that make you feel? And then you lead into is anyone saying mean things to you or pushing you around? That's one way to tease it out. I have other times where parents come in and we talk about it. And so, oh yeah, they're getting bullied. We're working with the school system and take it from there. And I usually, in the office, I'll teach kids some strategies to kind of help work and defend themselves, because especially for older kids, there's a lot of teaching resiliency is really, really important, because it helps the kids stand up for themselves and learn to manage conflict and do conflict resolution on their own. That's a really important skill for them to have growing up in life. It's a really important skill to make them less of a bullying victim and less of a target for bullies. So partly because kids bully because it feels good, number one. It shouldn't. You would think, why does it feel good? It feels good because they have power over another child. And there are risk factors for kids to be bullied. They either saw it on TV or something happens in the home, something subtle even, but maybe not. Maybe they decided to make fun of a kid and other kids laughed and they go, oh, I'm getting attention. I'm the good one, yeah. and making fun of this other kid, and it keeps going. And there's a difference between teasing, which is done in fun and just a little bit, versus a relentless picking on, going after a child. Taking the power away. So that part is important to recognize. And then turning back to the kids who are being bullied, I teach them. I'll stand up. I've done this in the office. I stand up with them and I say, look me in the eye and repeat after me. And the hardest part is getting them to look me in the eye. I'm like, no, you look at me. This is important. You have to pretend I'm the bully. And we'll talk. We'll go over it. So repeat after me. No, thank you. Please stop. I don't like this. I will tell an adult if you don't stop, and sort of giving that chance to sort of stand up and be tall. And then I show the parents what we're doing. I said, practice this with them at home, because teaching resilience is an important part of preventing bullying and helping to stop it. Yep. And it should, for older kids, it should be the first line. For younger kids, adults still need to get involved. But for adolescents, young adolescents, teenagers, teaching them to kind of stand up calmly. Don't hit back, don't yell back, don't fight back necessarily, because if the bully gets a rise out of you, they still have control. It's taking control back, yep. Really.
Earlier in the show, I spoke to a Monona police officer about their new ordinance and an issue that may come up where involving the parents of someone who is bullying could uncover problems in the home and even put the child at risk. At what point do you talk to the parents of a potential bullier, and how do you handle that situation?
Finding the potential bulliers can be more tricky. A lot of potential bulliers are bullied already by another child, by potentially their parents. Not always. That doesn't happen a lot of the time.
Okay.
There is a small subset of kids who have emotional disorders who will bully because they don't understand boundaries, and the parents really do have a very hard time with them, and they're aware and they're trying. And there are parents who are abusive. Like I said, it's a common subset, but it's still a subset. I think it's not as common as people think. My personal belief is what happens more often is that the parents are kind of mouthing off, they're angry, they're not doing anything to the kid, but they're not even realizing that their own behavior, which has always been normal to them, is potentially influencing their child the way that it is.
We just have 30 seconds left. What is the first thing a kid should do if they're feeling bullied?
As I said to my kids, stand up, look them in the eye, and tell them, no, thank you. That's for the adolescents. For a young child, they should tell an adult.
Yeah. Dr. Bisgrove, thank you very much for joining us.
Thank you for having me.
We're going to come back and wrap up For the Record right after this.
You think it'll work?
I do.